joining us now, Kansas Republican Senator, and Dr. Roger Marshall. Okay, Senator, it's good to have you on. So we have also this fight. Politicization of antibody treatments. Republican Senator Tommy Tuberville sent a letter to the HHS Secretary Javier Becerra saying, what standards are you using to ration monoclonal antibody treatments to the states? They were previously giving it on an as-needed basis where the surges were. What's your take on this story?
Wow, Liz, it certainly looks like they're trying to prioritize moving that antibody treatment away from red states to blue states. I don't understand where they're coming from. The system was not broken. It was working well. This is the first time the administration has ever mentioned anything except vaccines as an alternative to taking care of this virus. So one more crisis being created by this president.
So what happens now is the states have to they have to get their state health department to turn to HHS and ask them for doses, and then HHS doles it out. We've got 7 states, including Alabama, Florida, and Texas. Notably, Republican states were told these new protocols would cut their supply. The White House press secretary is saying this is about equitable distribution. How do we know that more supply is going to the blue states? Does the blue states need them?
You know, Liz, I'm not sure what they're doing. When they mention equity, you have to look really closely to what they're doing. So I can't follow their math at all. Certainly, we had a much worse outbreak in the southern part of the United States a month ago, and now as this Delta variant spreads across the nation, they're going to need more of them further north. So this is the way this virus has acted from day one. It attacks little areas and starts spreading. Those are the ones that need these antibodies.
You know, Senator Tommy Tuberville's office said his office talked to drug suppliers. They say there's no supply shortages there. He's worried about political bias and a lack of clarity. And we have to also note that taxpayers are funding all of these treatments, too. So when you look at this, where is your concern that this could turn political?
Well, I think it already has turned political. When there's basically the president's taking on governors and the HHS getting involved in the distribution of this drug. Again, this was a solution in search of a problem. Everything was working fine. I was not hearing of any complaints from doctors or emergency rooms having access to this until the president and HHS got in the middle of this one.
Okay, so the Senator Tuberville is saying he's worried about undue political pressure put on the states to comply with whatever additional COVID-related mandates that the White House deems appropriate. I mean, so when you look forward to this, when you see more bureaucracy inside antibody monoclonal treatments, when Texas and Florida is trying to ramp it up, there's also this, push by the White House saying, get vaccinated. There's a lot of unvaccinated people in the South. Is there anything that you're hearing about this when it comes to rationing of these antibody monoclonal drug treatments in terms of saying, you know what, we're not going to give it to you, we're going to ask that you get your people vaccinated?
Liz, I think that whenever there's mandates coming out, especially a vaccine mandate, you're going to just get lots of pushback. We did a couple of town halls this past weekend. I've never heard people more upset and more determined. And on the other hand, we have the opportunity for a booster shot for seniors, which would save more lives than grade school, high school kids wearing 7 masks at the same time. So the booster vaccine would be very helpful. These antibody treatments are very helpful. This administration has never talked about natural immunity. They've never talked about building up your own immunity. They never talk about these treatments that are out there that work as well. We've made great progress in this. Right now, the White House should be focusing on getting those booster shots for seniors and drive down the mortality.
Senator Roger Marshall, it's good to see you. Come back soon. Coming up later this